Hi, everybody, and welcome to this edition of the Taking Control of Your Diabetes podcast. I am one of your hosts, Dr. Jeremy Pettus, joined as always by my good friend and colleague,
Dr. Steve Edelman.
So if you are just listening to us for the first time, Steve and I were both diagnosed with type 1 diabetes at the age of 15. We're both now adult endocrinologists at the University of California, San Diego, and we work for the not-for-profit organization Taking Control of Your Diabetes that Steve founded almost 30 years ago now. So, Steve, this topic, or this episode, if you will, of the podcast is on mindfulness and using, breath and mindfulness to reduce stress, particularly as it comes to diabetes. And to talk about this, we have a very special guest, as always, with us. So tell us who we have with us and tell us about this episode.
Yeah, we have Preethika Ekanayake, who is on faculty at UCSD as an endocrinologist, but has a very interesting background. And I have to say that her podcast that she did with us on intermittent fasting is the second most listened to podcast behind yours and mine on the science of type 1. And that's a lot of good podcasts for people to listen to. And we also did a dose on it as well, and a lot of good stuff on our website.
So, Preethika, say hi.
Hi, everyone. And thanks again for inviting me for another one of these great podcast sessions.
Yeah, well, and to be clear, her intermittent fasting dose is second all time. First is ours on, the science of type 1.
I said that.
So keep it up, but every once in a while it becomes first and I get a little jealous. So
yeah,
I do too.
I have a question of how to get back up to the first place.
Well, maybe this will probably help you, which I'm not too happy about.
And I think your background, the way, and you're going to tell us yourself, but where you were born and raised, it's been a part of your life. So tell us about you.
Yeah, sure. So I, as you all mentioned, I'm a clinical endocrinologist at UC San Diego. I trained at UC San Diego for residency and fellowship, and very lucky to be here and have the great mentors in you guys and everybody else. But I've always had this background of kind of meditation practices that I've done as a child, just from my cultural background where I grew up until the age of 12 before my family migrated here to the U.S. So growing up in Sri Lanka, it was kind of part of our culture because of Theravada Buddhism, which is one of the oldest branches of Buddhism, being the main religion there. Meditation and mindfulness was taught and almost just part of life. It wasn't really specifically taught. It was part of life when I was growing up. So, we would meditate a lot when I was a kid, and it was just part of what you did when you went to the temple, even at school. But it was a very different type of meditation from what I do now. Back then, it's, sitting on a cold, hard floor, cross-legged. Sometimes your foot would fall asleep because it'll be hours of meditation.
Well, that's what I got for being punished for doing something wrong. Exactly. You're doing that as part of your usual gig.
Yeah, it was great babysitting for the parents, to have us be looked over by monks and nuns and just, keeping the kids all in line. But, when I migrated here to the U.S., things got busy. I mean, life get busy. It's more fast-paced. We all know, things are only getting busier with more technology and how intertwined we are with technology. And I ended up really leaving my practice kind of unconsciously and not meditating for a long time. And then I really experienced I would say, side effects of it. And I had some issues with a loved one passing away, some complex grief issues. And I decided later on, maybe about several years back now, that maybe I need to make a really mindful, no pun intended, mindful decision to get back into the practice of mindfulness and specifically meditation.
Well, that's what I was going to ask you, because I feel like, the term meditation has been around for a long time, but mindfulness seems a little bit more like a buzzword to me lately. So are they the same thing? Are they different? What is meditation? What is mindfulness?
Yeah, that's a great question. So, I see it as meditation is a way of achieving mindfulness, but mindfulness doesn't always have to be meditation. Mindfulness can come in all sorts of forms. So I can define what mindfulness is, and I think there's a lot of definitions of it, but most of it is basically awareness. Being aware of what's happening right now and being in tune to what's around you, what emotions you're going through. But I think the caveat is without really projecting and interpreting those emotions, and without putting a lot of judgment into your emotions and what's going on in your surroundings. So it's being aware without being overly attached. That's mindfulness.
You know what? This is not a joke, but it almost sounds like marriage counseling. To be aware of your surroundings, to just listen, don't put too much interpretation into it.
Yeah.
I mean, you're looking at me funny, Jeremy.
No, I'm just thinking we were having this conversation before we started this podcast that here at UCSD for anybody really, they offer this mindfulness course, and it was 2 hours a week, and I enrolled, and I really enjoyed it. I went to a couple classes, but it was like 5 to 7 p.m. in traffic, so I started getting stressed about making it to mindfulness course, so I dropped out. But I remember the first couple classes, and one of the things that they did is they had to close our eyes, and we ate a raisin. And they said for the next 2 to 5 minutes, just focus on eating this raisin. And, the experience of, what it tastes like, what the process of chewing was like. And, as other things kind of came into your mind, like you said, not judging that like your mind would wander somewhere, but trying to bring it back to that present moment. So that felt like a good kind of example to me of what mindfulness was.
Did you have a choice of chocolate covered?
Yeah, I was like, I want a raisin, come on, can we get a
one raisin?
Yeah, one raisin.
I think that's actually a fantastic example of mindfulness. There's plenty of these exercises one can do from home, because yes, it is very easy to fall out of doing something that's scheduled, because then you get stressed out about that. The whole point is to try to minimize the stress associated with it. So there are things like coffee meditation. So I do that quite a bit, where with my morning cup of coffee, I kind of think about where the coffee bean come from and who made it and what flavors am I experiencing.
Seriously?
I do get lucky because my husband roasts his own coffee, so I'm a little pampered by that, and it's good coffee. So maybe I can do that a little bit easier. But you can do that in all sorts of ways. You can do that while you're driving. I tend to do that after a busy day in clinic, where I get back in my car and then I just have to think about, okay, I'm driving. There's a lot of stuff that happened at clinic, good or bad. But what am I doing right now? What am I passing? What's my surroundings like before I get back home? Because otherwise my mind's kind of racing either to the back past or to the future, what I'm going to do when I show up. And I'm really not 100% there as a person.
Well, that's kind of what I was going to ask. Well, we'll get to diabetes and how this might be specific to people with diabetes. But this sounds like a funny question, but why do you do this? Like, what benefits do you get out of these practices? Yeah,
so I think, some people are lucky to just innately have this. And I really envy those people. I don't have this. I'm, just through my training and my personality and being trained to be a doctor and just being a immigrant who had to work a lot to get to where I am, I became kind of an intense person, which was very different from how I grew up in Sri Lanka. So there was a point where I realized, like, oh, I'm an intense person. That's my personality. But how do I take it a notch down so that my relationships are healthy and I'm able to be present for people around me and for my patients without overly trying to rush things forward? So that's the benefit I get. I get to check myself and regulate my own emotions, and not to be judgmental of negative emotions or overly positive emotions when I'm with other people. Basically, checking my emotions is the benefit I get.
Yeah. And what about, if we transition a little bit to diabetes? I mean, maybe first, I guess we can recap some of the unique emotional distress that people with diabetes might have and how you think this mindfulness might play into whatever it might be, like improving their distress about diabetes, improving their blood sugars, all that.
Yeah. I think, you guys had Dr. Bill Polonsky here talking a lot about diabetes distress, and you both live with this. chronic illness is just always present, right? So it could be diabetes, it could be something else. It could be a psychiatric illness, depression, anxiety. Meditation specifically has been shown, and also mindfulness in any form, it doesn't have to be meditation, has been shown to actually help people overcome some pain sensations, not to erase it, but to overcome and cope with it. Same thing with anxiety, depression, so mental health benefits. Same thing with cardiovascular risk reductions and some improvement in A1Cs because, as we know, when we're stressed and full of adrenaline and cortisol, we can have some higher insulin resistance. So small studies, right, looking at meditation and these kind of chronic health conditions, but overall improvement in all those conditions because of, I think, shifts in perspective as well.
Yeah, more than just cortisol stress, it's the stress of dealing with our diabetes, and it's a 24/7 job. And as Bill Polonsky say, with no timeouts, no breaks, no vacations. And, when I think about the hassles it is living with type 1, for example, there's no wonder that only 20% of people with type 1 have an A1C less than 7. It's hard. Everything from, the injections, long-acting, short-acting, when to give it, how much food to eat, what type of food, intensity of exercise, duration of exercise. And then on top of all of that, you got the day-to-day fluctuations that are frustrating. And then there's not a single person with diabetes that doesn't think about all those famous complications, eye, kidney, nerve, and heart disease. And I think the older you get, and I'll put myself in that category, it causes more mental anxiety than it did when I was younger, when you think you're invincible, kind of like Jeremy.
Mm-hmm. Thanks, Steve.
He's invincible. He really is.
Well, I was just thinking that, we have all these great medications now, especially for type 2 diabetes, obesity, but how often do people come into our clinic and they say, is there anything else I can do? I would like to be off these medications, or in addition to these medications, are there things that I can do? And we talk a lot about diet and exercise, but here's kind of something new or something unique that doesn't have to be, and actually shouldn't be, that difficult or that time consuming. So let's start to walk through what this might look like for somebody. They're like, all right, I'm sold. I want to be mindful. How do I start? Do you start with breathing? Do you start with what kind of education would you give somebody?
Yeah, so I have had few patients ask me about this, or I have brought it up kind of in a very gentle way, like, have you thought about this? Because mindfulness, like you said, is a buzzword that's going around, right? So in that situation, if I'm noticing, they're doing okay, but there's a lot of self-criticism or just guilt about what they're doing and not doing, specifically about, we're going to talk about diabetes, type 1 or 2. I have brought up meditation and mindfulness. So, the easiest way I think for people is, I say, do what works the best for you. It's very similar to exercise. So if you get a panic attack by sitting there hyperventilating from focusing on your breath, which some people can, then don't do that,
That's good advice.
Yeah, but maybe, you leave your phone home and go on a walk and focus on how your body's moving during that walk, like your arm position, as weird as this sound. Where's your, exactly, or you do a little dance like Steve is doing right now. How are your feet, following each other? What's your arms doing? And if you're kind of focusing on that and your mind just goes away and start thinking about the next day, or what am I going to cook later, or whatever worries you got, gently bring it back to that movement. And think about your surroundings. So that's a good walking meditation one can do. That's very common if you are not a type of person who can sit and do a usual meditation. But if you are, one of the things I like to do, like first thing when I wake up in the morning, and I do it with my coffee, because I let myself do whatever I want now. I don't have to not have anything on my hands and sit on the floor.
And your husband's like, can you pay attention to me instead of just being mindful of this?
Excuse me, dear.
I do close the door. There's no dogs. There's no husband. And then I think about, my breathing up and down. So inhalations, exhalations. Sometimes I count. So 1 for inhalation, 2 for exhalation, exactly, 3 for inhalation. And I do that for 10, and then I repeat that again. And during this process, I do find myself thinking about, I have this patient coming up. I have to think about what to do. And I gently bring myself back to the breathing, I think the key is just forgive yourself when that happens, because it's not supposed to be perfect. Our thoughts are, the mind's, mind has a mind of its own. So bring it back gently and say, okay, I'm going to restart my counting and really focus on my breathing. So you could either count your exhalation, inhalation, or just focus on how you're breathing, where do you feel it, how your diaphragm expands. Those are some, ways you can start.
And then do you recommend apps? Or I'm just thinking as you're talking, I mean, I have my activity thing on my iWatch, and I think there used to be reminders to breathe or, these kinds of things. Are those helpful? Do those just become more... there's apps that you can go to in your own time, but the ones that tell you to breathe, those seem more intrusive to me.
They're intrusive to me, and I think maybe some people find them healthy and they can follow that. The same with the apps that tell you to stand up, and I'm like, I can't, or I'm driving, right? And my main, at least for me, is how I can also get away from some of the technology too, so that doesn't have to remind me. I just do it when I want to do it on my own time, not because I'm getting a reminder. But some of the apps that I have found useful are things like Headspace, and that's a very common one. UCSD actually has some, most companies actually give you some discount for this. But Headspace is wonderful. There's student discounts for it. There's discounts for healthcare providers, for service members. Headspace has a radio app that's free on podcast, and I listen to that on my way to work.
So what is Headspace?
Yeah, it's a meditation app, and it's nice. It has walking meditations, it has workouts. There is a subscription fee, obviously, so that's where the free stuff come in handy for some people, because the thing about meditation is you don't have to break the bank to do this, but maybe some overview would be helpful. The free app that I really like also, besides Headspace meditation app, is Plum Village app. And that's by, the tradition through Thich Nhat Hanh, who's a Vietnamese, who was a Vietnamese Buddhist monk, kind of practicing the Zen Buddhist tradition. There's a free app of that with all sorts of free meditations.
What's it called again?
Plum Village.
How do you spell that?
Plum, Plum.
Okay.
Yeah.
Okay.
And you guys can have some of the resources on there. But Plum Village app, they have the coffee meditation for 5 minutes where you sit with your coffee and smell your coffee and do that kind of mindful things.
Put a couple raisins in your coffee.
Yeah, you
watch
can do
it
that.
Expand. But Preethika, I had a specific question. You made me think of this when you were talking about counting your breaths, the seconds in your breath. Whenever I have a hard time sleeping, I'm worrying about stuff. Happens pretty frequently. And then, the old saying, just count sheep. Why doesn't that work? And can you use meditation to help?
Yeah, great question. I have some of these where I wake up in the middle of the night. I'm having a hard time. And it all depends on your situation, right? So I think it's really hard to use this off the cuff once in a while.
I see.
So that's where practice makes perfect, or practice make close to perfect, I should say, because it's not going to be perfect no matter how much you practice. Even the ordained nuns and monks have worries in their lives, right? So the main thing is doing this very regularly help us take it off of that space of meditation into your day-to-day life. So one of the big things for me is when I first started going back to meditation, I found myself just meditating, saying, oh, I meditated, but never putting that to use when I'm in a stressful situation. And then I find myself still agitated or reacting quickly or whatever, saying something I shouldn't say in that heat of the moment. But then lately, it's been, with more practice, I find myself doing the breathing and calming myself down and making the situation lighter because, it really does not need to be a big deal.
Yeah, I totally understand that. You can't just never meditate and then say, okay, I'm stressed, let's do it.
Yep.
Don't expect it to work, So, yeah, no, that's helpful.
Yeah, so you would say, okay, people are listening, they want to get into this. This is something they should try every day, make part of their... I'm guessing initially you'd have to kind of set time aside to practice, I suppose, and then you could try to integrate it more into your life.
Yeah, I think, that's where I wouldn't also commit to like an hour, because I think that's very hard when you first start out. I would do 5 minutes and then try to do 10 minutes. And the cool thing about the Headspace app, which most people are using these days, you could set the time of meditation to 5 or 6 or whatever you want to do. So it depends on your mood. You're not a bad person if you can't meditate for 30 minutes. Do 5, and the next day try to do a little bit more. And later in the day, try to incorporate it during like lunchtime. So I do my Monday walks every day in between my clinic, and that's where I just leave clinic after my lunch. I just do my roundabout UCSD walk, and I think about how my body moves and come back refreshed for the afternoon.
You tell your husband not to call you.
Exactly.
Yeah.
That too. That helps.
To me, it really comes down to making it a habit.
Yeah.
And once you do it and enjoy it, you'll continue. We've had meditation experts at our TCOYD conferences when they used to be face-to-face. Could you imagine a crowd of like 1,000 to 2,000 people sitting around their lunch table, and they followed instructions, and you could have heard a pin drop. I participated as well, and after like 5 minutes, I felt so relaxed. And I said to myself, Steve, you got to do this every day. And of course, I didn't. But doing this podcast with you, I'm gonna try to do it on a more regular basis.
Yeah, I was thinking the same thing. And the apps I did like is that they would, these guided kind of meditations. And I would usually do them kind of at night. And they would say, okay, we're going to focus on your feet.
Yeah.
And start there and just really think about just your feet and just your toes. And now, okay, we're going to think about your knees and focus on, the blankets touching your knee. What does that feel like? All that. And, I found that really kind of relaxing, et cetera. And as you're talking, I'm thinking about, again, the goal for people with diabetes, like you were saying, you're meditating and your mind wanders somewhere else, not to be judgmental of that and bring it kind of back to where you are. And I think that rings so true for people with diabetes, that we can, with our CGM, see our blood sugars high or low all the time and just immediately react to, frustration or anger. And I think, a goal for me would be, not having that visceral response so much. It's just a number, the blood sugar's high or low. I'm going to treat it. I'm going to bring it back to, into range. So I think that really kind of like that parallel might be, helpful for people with diabetes.
When the pharmacy keeps you on hold for 8 hours and then, then they hang up by accident. You mentioned in some of the notes, transcendental medication, and I love this one. Loving kindness meditation. Yeah. That sounds, oh man, I'm
cheesy.
Ready for it. Well, what is transcendental?
Yeah, so transcendental meditation, there's all forms of meditation, but with TM, there's a big TM group here in San Diego, but it's basically repeating a word. So if it's difficult to focus on the breath and follow the breath, some folks have like a phrase or some mantra, they call it. They repeat like a word. Om is one. I know you guys have done like some videos on this.
Om. Is that what that's from?
Yeah. There's a whole definitions for that, but you could do that, or it's you could repeat anything. So I think the bottom line of this is meditation doesn't need like keywords. It could be what you make it to be. You could use whatever word no one else need to know.
Time and range.
Time and range.
Time and range.
3 words. You could focus on that. I personally don't do TM because I like the breathing and the walking type of stuff. Loving kindness is a hard one for some people, because you are supposed to, not only use people around you. You kind of progressively train your mind to really pass that on to like neutral people, maybe your enemies if you have any, just to hone that muscle of empathy for everybody, not just your inner circle. So that's always a challenge for a lot of people, especially if they're in the middle of like some intense situation. But that is I think that's a very important, useful meditation that you can kind of get into after getting the basics. That'd be a hard one to step into as a beginner, though.
I'd love politicians to get into loving kindness meditation. Wouldn't it be nice to get away from all this crazy negative verbiage that's out there? Yeah. Well, it sounds simple, loving kindness, but what you're saying is it's a little bit harder.
Yeah. Because it's, you can start off with your dog and your spouse and your kids. That's easy because you have loving kindness. Maybe, depends on the day, I suppose, with your inner circle too. But then it's really spreading that to other people. Like, may you be healthy, may you be happy. And if, you're progressively going to start thinking about people that you might not quite get along with. You spread that loving kindness to that person. And that's very challenging for many people. So this is all about working out your meditation muscle.
Well, I think empathy is a good word too, but I get it. You're to transfer some of this kindness and loving to people you wouldn't normally want to even talk to.
Yeah.
That's a challenge. And it's probably a good challenge,
Well, I think, this has been great. And I'm just relaxed sitting here listening to you guys talk about being relaxed. So I really appreciate this, Preethika. Is there anything that you want to leave people with? Again, if people want to get started with this, or just any final kind of thoughts?
I think some other resources. Now, obviously, I don't have any financial interest, so I think I've disclosed that. But I really like the Plum Village app. And then we're in a place here. We're close to Escondido. Deer Park Monastery is in Escondido. Fall is a beautiful time to visit. It's free. Every Sunday, it's open to public if you sign up about a week in advance. And they start their day off with walking meditation, and it's just beautiful. And they end the day with like some Dharma talks, some Buddhist Dharma talks, and also a vegetarian lunch. It's all included. Nice to take your kids. It's really important for kids, I think, to get into meditation a little early, just because of what the world is like right now, right? And then the other thing is I'm reading this Imperfectionist, which is a column by Oliver Burkeman, and he just put out a new book called Meditation for Mortals, and that's a good read. You can read a chapter a day. It's very short, and it kind of
for mortals.
For mortals, not for immortals.
Yeah, I was going to say
meditation for mortals. Yes, immortals. I would not be out
for immortals.
Yeah. And then the last thing is the Viktor Frankl's book, which you guys probably heard of, Man Searches for Meaning. That's a fantastic short autobiography, and that kind of really drive home the point that you could do this practice in any setting, because he really wrote down his thoughts after his time in Auschwitz and during the Holocaust.
Oh, wow.
Yeah.
Well, I think just want to say thanks again, Preethika. This has been great, and I predict that this is going to be your new number one. It might take a little while to surpass your intermittent fasting, but I think it'll get there.
When people snap out of their relaxive trance,
hopefully if you're driving,
click is our favorite.
Pull over if you're driving, do some meditation, then get back on the road.
I'd be worried to do it while I'm driving, to be honest.
Well, you shouldn't,
because
you might fall asleep.
Because I would lose attention to whatever works for you. I get it. Preethika, thank you so much.
Thank you so much.
This is something we all should be doing on some level for some amount of time.
So thank you again for listening. If you liked it, please share, like us, follow, subscribe, all the fun social media things. And we look forward to speaking with you guys on the next episode.